Okay, so welcome back to the session 14 of our medical astrology class.
Yes, sir.
Okay, so let's resume. So one thing I told we'll discuss now is this what is that? Paralytics.
Paralytic attack.
Okay, so we'll see that. Paralytic attack. So structure is a Karaka of planet. Karaka planet is Saturn, comma Mercury. So paralytic attack means first which part of the body will not coordinate properly?
So nervous
Nervous
system,
system
Nervous
it's
brain.
affected.
brain.
Brain.
Oh,
Brain.
sorry, sir.
What is the Karaka for that?
So Sun and Jupiter, sir.
Jupiter.
Sun and Jupiter.
Jupiter. So automatically Jupiter connection to sixth house bar, sixth lord, okay, plus Jupiter. All this is the thing. And in sixth house, Saturn plus Mercury combination. Mercury, like you all told, nervous system. And Saturn means that legs and all will not this thing, no, along with Jupiter. Okay. Saturn is a Karaka for legs, we know. So that legs related issues also there. And for sixth lord, if there is a combination or a connection of Saturn plus Mercury, that is also problem. And again, sixth lord or sixth house becoming Badakam, Tithisunyam, or Astangam, Nicham. Okay. Plus, definitely affliction of Jupiter. Okay. So we'll try to understand this in help of a chart. Let me draw that chart for you. Write down the degrees. Rahu degree, okay, I'll come. Ascendant degree is 1640. Okay. And Sun degree is 1527. Moon degree 2612. Mars degree 2417. Mercury 1204. Jupiter 1240. Venus 2856. Saturn 2609. Rahu 1639. Ketu 1639. Mandi 2258. Okay. Now let's analyze this chart. Which is the Lagna here?
Mithuna Lagna, sir.
Correct.
Gemini.
Gemini Lagna. Okay. So here, what will be the Tithi Shunya Rashis? 15 degree here.
4 corners.
26 degree here. Correct. All the 4 corners are Tithi Shunya. Jupiter plus whom? 6th Lord. Correct. And for this Jupiter plus 6th Lord, Ketu aspect is there.
Yes.
Yeah.
Yes, sir. Yes, sir.
Yes, it is there.
Okay. And this Mars
Hmm.
sitting in star of whom?
Mars is sitting on the Guru's Nakshatra, sir. Vishaka.
Jupiter. Right.
Yes, sir. Jupiter.
And what is this Jupiter?
Jupiter is the
Seventh
Tithi Shunya
and-
Lord, sir. Seventh and the
Sir,
10th.
Badaka, sir.
10th Lord.
Badaka, sir.
Badaka.
Badaka. Yes, sir. Badaka.
And Saturn. Whose star?
Mars star, sir. Chitta star. 6th Lord star, sir.
6th Lord star.
Yes, sir.
And it is with whom?
He is with Mercury, the Lagnadipati itself, and Tithi Shunya Lord as well.
And Mercury plus Saturn in
Yes, sir.
Tithi
In the
Shunya.
4th. Yes, Tithi Shunya.
Correct.
Yes, sir.
Mercury, nerves,
Hmm.
nervous system.
Yes, sir.
Told wherever this sun is joining, it is going to give problem. Mercury plus Saturn, nerves problem.
Yes, sir.
And Mandi in Mercury Nakshatra.
Yes, sir.
Sixth Lord, Mars. Correct.
Yes, sir.
Sixth Lord is Mars only no here.
Yes, sir. Yes, sir. Yes, sir.
He is plus having combination with
Hmm.
Badaka Adipati,
Badakadipati,
Jupiter.
Jupiter.
Correct.
Yes, sir.
Yes.
And 6th Lord also
Tithi
and
Shunya Lord
Badakadipati
also.
Nakshatra. Yeah.
And in the
Tithi Shunya.
10th house connection is there. Correct. Jupiter
Yes.
is the 10th Lord. No?
Pisces.
So
Yes.
6
Yes,
and
sir.
10.
Yes, sir. 10th Lord.
So-
Karmic cutters. Okay. Yes, sir.
Karma disease.
Hmm.
Ascendant. We told
Hmm.
ascendant should go weaker. Ascendant is Tithi Shunya.
Yes, sir.
Ascendant Lord, Mercury.
Hmm.
Tithi
That is
Shunya
also. Yes, sir.
plus Saturn.
Yes.
Now,
Along with
Saturn
8th
we
Lord.
told is the 8th Lord.
Hmm.
And for this Lagna Lord, Ketu is aspecting. Correct.
Lagna Lord.
Yes.
Ketu is aspect.
He's
Hmm? Who's the Lagna Lord?
Lagna Lord Mercury, sir.
Lagna Lord is
But
Mercury-
Mercury.
Ketu is in Sagittarius,
Ketu
no,
is
sir.
Hmm.
So it's not
Correct,
not
correct.
aspect.
It's not aspecting.
Now,
To the
this
6th
Ketu
Lord, it
is,
aspects.
Hmm?
So the 6th Lord Ketu's aspect is there.
correct. So this Lagna
Sir.
Lord is sitting in Badakam. Sorry, this Ketu is
Yes,
sitting in
yes.
Badakam.
Badaka.
Yes, sir.
There.
Hmm.
Next. Another thing we have to see is very clearly we have to see one more thing. Rahu is sitting in Tithi Shunyam.
Yes, sir.
Correct.
Yes.
And
Yes.
this paralytic attack means in the beginning class itself I told you Vata means what? Paralytic body and
Yes,
not
sir.
moving means Vata Nakshatra,
Immo-
right? Mercury
Yes,
is sitting in Asta. So Mercury is sitting in Asta. Asta is Vata Nakshatra or not?
Yes, sir. Water Nakshatra.
Vata, not water. Vatam. Vadam.
Vata.
Okay.
Yes.
Vata, Pitta, and Kapha.
Yes,
Okay.
sir.
And for this Lagna, there is Badakadipati is aspect is there. Jupiter's aspect is there. Right? For Lagna,
To Lagna, sir. Yes,
Lagna.
Badakadi.
For Lagna,
Yes, sir.
Badakadipati, this thing is there. And
Yes,
Rahu
sir.
is in also Tithi Sunyam. In Panchangam class, I told Rahu in Tithi Sunyam means what? Vamsa dosham.
Yes,
Right?
sir. And it's also Rahu
Generational,
Nakshatra, right?
generational.
Generational
Yes,
dose.
sir.
In Panchang class, I have taught.
Yes,
And
sir.
where Rahu is sitting in Arudra, right?
Yes.
One nakshatra.
Yes.
Okay. And
Yes, sir.
what is the ascendant nakshatra?
That is also
That is also
Aradra, sir.
Arudra, right? So Vamsha,
Yes.
that Vamsha dosham is coming for this guy also. And we saw it's
Mm.
a karma noy also, that is karma disease also. And
Mm.
this for notes, we will take dispositors. So where is the dispositor Mercury? He is also in
That is
Tithi Sunyam,
in the Tithi Shunyam, sir.
right? And
Yes,
sixth
sir.
Lord
Mm.
Mars,
Mm.
sixth Lord Mars,
Mm.
who is he? He is with
Mars.
Badakadipati
Jupiter.
Jupiter, right?
Yes, sir. Yes, sir.
And this
Badakadipati in
Badakadipati is also having connection with whom? Ketu.
Rahu. Oh, Ketu's there and
Ketu
it is
only,
in
no
the
madam
Rahu.
here.
Yes, sir. Yes,
Ketu only.
Ketu's aspect is there. And
Okay.
Jupiter in
So,
Swati Nakshatra, I was about to say
right.
that, sir.
And all this was related in this paralytic. If it all these conditions, you apply this, everything will pass. Correct or not?
Sir,
Yes, sir.
yes, sir. Sir,
Mm.
even one more thing, sir. If we see, sir, Mercury and Jupiter are in close conjunction degree. So it is a Lagna Lord making by default connection with Badaka, that is Jupiter, and where Jupiter and
Correct,
indirectly with
correct.
sixth Lord also Mars. So that also
Vicinity
gives a clear.
connection. Correct. Okay, more points are also there, but if this much, if you know, we can very clearly say it is a paralytic issue is going for
Yes, sir.
this person. Okay,
Yes, sir.
this is the thing. So, like I told, I given you structure, format, everything. No, I know how much hour, close to 25-30 hours if you have done also. Some people will think, sir, that is okay. There are students, okay, 25-30 people, they are from long time. We are also from long time, but any shortcut is there. That is natural tendency, right? Because they are catching up. They are catching up. It's not they don't want to learn. They are catching up. Okay. So from that perspective, what I will tell, structure is this only. Now many of you are sharing with me, sir. I for this is I only did, sir. For that thalassemia, I only did, sir. Sir, for fat or obesity, I have done, sir. Like that, you are doing excellent. If you do one week one disease also in 1 year, how many diseases you would have done? 50 disease. Now with the structure, whatever I taught, if you are teaching 50 disease to your student, don't you think that is your innovation? You have the unique USP, right? Nobody can stop you from that. That is what I was striving for all that, and you are doing it. I'm very extremely satisfied with that. That is what makes it. Now, sir, structure under is okay, sir. Anything, what is that? Fast food is there. Structure will follow, will do, sir. Some fast food is there. Yes, fast food is also there. You can take that. Means each organ represents certain planets and certain bhavas. This is not substitute. Already whatever structure I told is primary. There is no doubt to that structure. Additionally, sometimes a planet will hold a portfolio. Now, whenever you are seeing a chart, quickly you see if this organ, this planet is getting affected, this bhava is getting affected, that related diseases also you tell. Then you go to the structure and do detailed analysis. So quickly I want to see and I want to say, means there is also a, what is that? Snapshot view. Okay. Here sometimes Babas can vary, planets can vary. It doesn't mean it is contradicting. No, it is only an additional to see at single point of focus. Further, if you want to go in depth, you can use the structure. So will you all write down? I will give you for some 25-30.
Yes, yes, sir. Please, sir.
You put 4
Yes, sir.
columns. Organ, Rashi, Graha, and Bhava. Organ, Rashi, Graha, and Bhava. And the organ you write head. And Rashi you write as Mesha Rashi. And Rashi you write it as Mesha Rashi. And Graha you write it as Sun and Mars. Sun and Mars. And Bhava is 1, ascendant Bhava. Bhava is 1, nothing but ascendant Bhava. Next, brain. Rashi is Mesha Rashi. Graha is Sun and Jupiter. Sun and Jupiter. Bhava is 1. Next, eyes. EYES, eyes. Rashi is again Rishabha Rashi. Okay. Graha is Sun, Venus, and Moon. Sun, Venus, and Moon. Okay. Bhava is 2 and 12. Bhava is 2 and 12. Okay. Next. Next. Hairs. 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 Rashi is Mesha Rashi. Planet is Saturn. Planet is Saturn. Okay. Bhava is first Bhava. First Bhava. Next, eyebrows. Eyebrows. Rashi is Taurus. Rishabha Rashi. And planet is Mars. Bhava is 2 and 12. Bhava is 2 and 12. Next, teeth. Teeth. Rishabha Rashi. Okay. Planet is Mars. Bhava is 2. Okay. Next, ears. Ears. Gemini. Gemini. Mercury. And Bhava is 3. Next, skin. Skin. Gemini, Mercury, and Rahu. Bhava is 3 and 11. Next, cheeks. Cheeks. Taurus, Venus, and 2. Okay. Next, pituitary. Pituitary. Rashi is Mesha Rashi. Graha is Sun. and Bhava is 1. Just Cancer, this is Kadaka Rasi. Moon and Mars. Bhava is 4. Next, lungs, Karkataka Rashi, that is Cancer, and Gemini. Planets are Mercury and Moon. Bhava is 3, 4. Okay. Next, art, Cancer and Leo. Cancer and Leo. Sun, Saturn. Bhava is 4 and 5. 4 and 5. Next, backbone. 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 You write down. Gemini, Cancer, Leo, Virgo. And the planets are Sun, Mars, and Saturn. Stomach. Stomach is Leo, Sun, and 5th. Next, umbilical cord.
Bhava zone.
Umbilical cord. Leo, Ketu, and 5th Bhava. Leo, Ketu, and 5th Bhava. Next, hip. Hip. Virgo. Mars and Mercury. Mars and Mercury. 6th Bhava. Next, write down. ENS. Scorpio. Scorpio. Ketu, 8th Bhava. Kidney. Libra. Venus and Mars. 7 and 8. 7 and 8. Next. Uterus. Uterus. Scorpio. Moon. Four and 9. Next, fear. Scorpio. Moon. Fifth bhava. Leprosy. Aquarius. Venus and Rahu. 3,11. 3,11. Next. Cancer. All Rashi. Sun, Ketu, Jupiter, Mars. Sun, Ketu, Jupiter, Mars. Primary Karaka, Sun and Ketu. There is no specific bhava for this. Okay. Next. What else I can see? Potency. Scorpio. Mars. And Gemini. Mercury. Bhava is third bhava. So how many is done?
So 24, sir.
24. Okay, one more I also will give. Take it.
Yes, sir.
Sperm. Leo. Sun. Bhava is seventh.
Sir, may I know the bhavas for backbone, sir? Is it fifth and the sixth bhava, sir, for backbone?
Backbone I told no already.
No,
All
you
the
gave,
four
sir.
the Gemini, Cancer, Leo,
Leo work.
and Virgo I told. Right?
Yes, sir. Rashis. Yes, sir. Rashis, yeah.
Sir, backbone means spinal cord, no? Entire spinal cord.
Correct, entire spinal cord.
Okay.
Now, for example, some sixth lord is sitting in the Gemini. Then that disc, you divide that disc. Accordingly, you say which area, L1, L2, like that you can say. Where that sixth lord is saying, sitting. Accordingly, we can say the problem. Understand? It is not any big Brahma Sustram. Very easy only. That is, you don't have that practice of seeing chart, no. That is the reason initially you are finding difficulty. But over a period of time, you will get habituated to it. Okay.
Sir, backbone bhava will be the Rashi only that you said that it's the same thing, right? 3, 4, 5, and 6.
Correct, correct. Okay. Usually we'll say for 6th planet, there is a medicine. For 8th planet, medicine is not there. Understand? Mars plus Moon means there will be IBP. Mars plus Saturn means there will be low BP. That's all. This 25 I have given, right? Fine.
Yes, sir.
One more
25
time.
is completed, sir.
One more I wanted to give. Let me see. Something comes to my mind. Okay, fine. So, yes, my God. This immunity bar resistant to disease, I told you, no? Write down. Immunity bar resistance to disease. Okay. So this IVF you covered, right, yesterday?
Yes, sir. Test tube
Yes,
baby
yes.
you have
Test
covered.
tube
You have
baby
covered.
So,
impotence, yeah.
sometimes
tube
they
baby
will ask you, when to do that IVF. It's a big procedure, right? Close to 15-20 lakhs they have to spend. You write down on birth Jupiter or on fifth lord. On birth Jupiter or on fifth lord. When transit Rahu or Ketu goes on birth Jupiter or on fifth lord. When transit Rahu or Ketu goes, then one can go for IVF treatment. Next, when fifth lord transits are Jupiter transits on Rahu or Ketu. On your natal Rahu or natal Ketu, when fifth lord or Jupiter transits, then also one can go for IVF. Sir, we are trying for children, sir. It will not happen. When you are trying for IVF only, it will happen. When trying for children, this is exactly opposite. Understand? Only when you are going for IVF procedure, this Rahu Ketu will act as positive. So only in Jamakala also will say, Pambu in Udaya means positive for childbirth. Means for IVF. Now, usually this Karasi Karnam is there, no? That Karasi Karnam you can choose as Karnam. If there is an option for you, you can choose. And even women born in this Karasi Karnam, for them that IVF success rate is high. Why? Because who is the animal for this Karasi? Elephant.
Sir. Elephant, yeah.
Elephant. Elephant's mind and body is very strong. During that childbirth time, you go and see. They'll be completely prepared for that. So like that, this Karasi Karnam is good. Okay. That means why again I am saying means, for example, you are seeing some chart that male is having putra dosham. Then if you get that person to get married to a Karasi Karnam female, 100% that they will have a childbirth. IVF or natural, but 100% you will get. Usually 80% of the times, Karase Karnam female charts, whatever you are still till today, there's, I can say, they were never had that difficulty in getting a children. Not 80%, I can say with confidently 95%. 5% we should always leave to God, the universe. Understand? That means what? Putra dosham will never work for people in this Karase Karnam. Okay. Even if there's some problem is there also for Karase Karnam people, automatically if they do Purnami Puja, okay, definitely they will have childbirth. Now you will say, sir, Karse Karnam you told, then why you are saying? Means if any that fifth bhava, affliction, everything is there, means still they will have because they are born in Karse Karnam. But child should not be born handicapped or autistic, like that. Problem should not be there or complications should not be there for the child. So from that purpose, we are saying that, sir. Okay. Next, you write down this one. Resistance or immunity to disease. When to go for the treatment and all. For IVF, I already told, but for other things. All right, Bhava is ninth. Rasi is Sagittarius. Right now, when transit moon or transit lagna, when transit moon or transit lagna goes on ninth lord or ninth bhava, or it is in the aspect of ninth lord, one can go ahead for treatment. When transit moon or transit lagna goes on ninth lord or ninth bhava, or it is in the aspect of ninth lord, one can go ahead for treatment. Libra. Now I am saying you should tell the answer. I am saying the transit moon is in Kumbha Rashi or Simha Rashi. Now, can I go for treatment or not? Why for Kumbha Rashi and why for Simha Rashi?
It is the 5th and the 11th connection, sir.
I already gave you the reason. Right. I gave you the reason. That reason you have to apply here and tell.
Rahu in Aquarius.
Mhm. Anybody?
Transit moon is in Aquarius,
Mm.
and uh, that's
That's
all.
all.
Yeah, Rahu is in Aquarius right now.
When did I tell you about Aquarius? I only told transit moon is in Aquarius. That's all. I gave you two planetary placements of the natal chart. Now I am saying why this transit moon is here means I am saying they can go for a treatment, it will be successful.
Sir,
What
it
was
is
the
in
other?
sorry. Go ahead, Vinay.
No, I was asking about the next two. What was the other planet which sir told?
Only one planet I told that. Sir.
Okay, only one planet.
Ah.
Okay, Saturn.
Now for this Tula Lagna, who is ninth lord?
Mercury, sir.
Gemini.
Where is that
Moon,
Mercury?
Karkataka. So like
Where is that Mercury?
No, Mercury.
When I didn't say Mercury's position.
No, sir.
No,
Only
Okay,
moon we
Guruji.
said, sir.
okay. Mercury is in Aquarius.
Oh,
We
that's
thought
right.
moon in
Okay.
Aquarius, sir. Okay.
Mercury in Aquarius, transit moon is in Aquarius.
Okay.
Natal Mercury in
Yes.
Aquarius, transit moon in Aquarius. Now, why I am saying if they go now, it will be successful.
Sir,
The
to
moon is.
Lagna, the night. Sorry, Vinay. Go ahead, Vinay.
No, ma'am. You go. Ma'am.
Okay, sir. To Tula Lagna, Mercury is the ninth lord, sir. And
Correct.
to the Kala Purushas, moon is in Purvabhadra Nakshatra. To the ninth lord Nakshatra.
When did I say this in Purva?
I am just telling. Ninth lord connection. Sorry, sir.
The ninth
To
lord.
10
It's connecting to the ninth, sir.
Connecting to the ninth
Yeah,
lord, Guruji.
transit moon is connecting
Moon
to the
and
ninth
Mercury.
lord.
That's all.
Natal,
That's the
natal
answer.
ninth.
Transit
Okay,
moon
sir.
is going
Okay.
on the ninth lord. Why you are all going somewhere? I
Okay,
clearly told
sorry, sir.
when transit moon goes on ninth lord, I told her not the rule.
Yes, sir. Yes, sir. Yeah, the rule is your rule.
Okay.
Yes, sir. One transit moon
Now,
goes on.
now
Yeah.
for the same lagna, I am saying moon is Simha Rashi. Then also I said it will work. Why?
Because it is aspecting the ninth lord.
Sometimes it may not. Why?
The seventh aspect.
I wanted
Direct.
to say the reverse. Means this moon is in the aspect of ninth lord.
It's a direct aspect.
Yes,
Yeah.
sir. Direct.
Seventh.
Why?
Seventh
Because
aspect.
I'll say why. Because suppose Saturn is there. Saturn is aspecting the third bhava, and their moon is there, right?
Yes, sir.
Because moon otherwise can see only seventh aspect, doesn't have 3 or 10. But if Saturn is the ninth lord, automatically still it can aspect that moon via the third bhava, right?
Yes, sir, correct.
Yes, sir. Yes.
That is the reason I told when transit moon or transit lagna goes on ninth lord or bhava, or it is in the aspect of ninth lord.
Yes, sir. Got it. Now I understood.
Now Mars is there, it can even see fourth or eighth aspect, no?
Yes, sir. Yes.
That means on that day, their body will have more capacity to take that medicine and treatment. So only we are suggesting that. Clear?
Clear, sir. Now understood. Yeah, thank you.
Okay. Okay. One more I'll give. Let me see how you are able to find out. Leo ascendant. Mars is in Capricorn. Sorry, Cancer. Now don't worry about Nicham, Mucham, all that. Okay. Mars is in Capricorn, Leo ascendant. This has come. Okay. Now you want to suggest him the treatment. So where and
Got
all if moon is there, this person can go for treatment. In
Sir,
transit.
can you repeat
Sir,
once, please?
Leo
Sir, may I
ascendant,
say?
Leo
Sir, may
ascendant and Mars in Cancer.
Sir, when moon is in this one, when moon is in this one, Libra, sir, and moon is in Capricorn, the person can go for the treatment.
And even
Aries
Aquarius.
also.
Why
Even,
Aquarius
even
is not there?
Aquarius.
Aquarius also,
Aquarius,
yes.
Because
Aries.
8 aspect is there.
Yes.
So what happened to Cancer?
Cancer.
Moon is in
Cancer
Cancer,
also.
it will not
Cancer
there.
also.
Cancer also, sir.
Why not this
No, I
one come
wasn't.
there?
I know sir would have said like that.
But 12th house, I was just thinking, sir. I was just thinking 12th
No,
house.
no,
Just
it is a ninth
sometime,
lord connecting.
just sometime back only I told, don't see
Yes, sir.
Ucham, Nicham or anything.
Yes.
Then
But that only, sir. Got it, sir. Give us one more
usually
example.
in our small, we'll do one thing. We'll count everyone except us.
True,
20
sir.
people are there. 21 will be there. We'll say 20.
Correct.
Understand?
Correct,
That
correct.
ninth lord only is there. You are left with that. You all went
Yeah.
everywhere.
A strong conjunction of ninth lord and moon is in Cancer side. That will not.
Okay.
Okay.
Yes,
So that completes your syllabus. So what I have not put in poster also I have covered. 5 to 6 diseases extra also we have covered. And close to 25 organs also I have covered. If you know which organ will get affected for which disease, structure already you have. Understand? So that you need not worry. So what else? What doubt you have? No doubt, huh? Happy weekend, huh?
In
Yes, Shonak sir, what is your doubt?
the previous question, we should not see
I'll
the
come.
date.
Vinay sir, I'll come. Yes, Shonak sir.
Yes, sir. I have a doubt in LDHD rule, sir. In that example, we had seen that the Ketu was LD 0.5 degree and Sun was 23 degrees. And you in the rules you said that in the IT rule is only applicable with transit Lagna and transit Moon, right? And we had assumed that transit Lagna is Libra and at 2 degrees, which is close to the degree of ascendant, and Moon at 23 degree in Aquarius, sorry, in Aquarius at 23 degree, which is the equal to HD of Sun. And that is why we linked heart problem because of Sun. So my first question is, sir, is this IT tool only connected when we are seeing the Prashna chart, because transit ascendant will only come in Prashna chart?
See, from transit you are only the ascendant and moon. This transit, ascendant and moon, IT indicator tool you are putting to which one? To the birth chart only you are putting.
To the birth chart we are putting, but we are putting it at the time of casting Prashna only, na sir?
Correct. When you are, no, that is what I'm saying. Here we are not doing any prasnam. We are taking only the, what is that? The client has come, that time you want to see what is the lagna running, where is the moon is sitting. That is what we are seeing. We are not casting any prasna there.
Oh, yeah,
Understand?
at that
At
time.
that time, what is the transit lagna, what is the transit moon, and we are giving this thing.
Okay. So the transit ascendant Libra was only an assumption, right?
Not assumption. When I saw it was the case, so I gave you that live case study. That's all.
Okay.
For your case, you can think it as an assumption, right? Because now we are not doing anything. Now, for example, you told at that particular time, I told, sir, you should have a heart related or blood related issue should be there. You told yes,
Right,
sir.
right,
Because
right,
for you it was taken live.
right,
And
right.
one I gave was which was already seen.
And this LD Ketu,
Mm,
which is at Scorpio,
mm.
at what time will this give a problem? Because this represents large intestine and constipation.
Mm.
When will this LD Ketu give the problem?
That is timing of event. Understand?
Okay, okay,
Timing of
okay.
event means we should know the dasha bhukti, everything. Okay, we
Okay.
already told na which were the planets connected. Like in the first example, Saturn dasha, Mercury bhukti, Sun and
Yes,
Saturn. In those
yes,
dasha
yes.
bhuktis, it will give the problem.
Okay, okay, right,
Mm.
right, right. Right, sir. Thank you, sir. Thank you.
Mm. Anybody, any other doubt? Hmm? Something you didn't understand? All clear for everyone? All good? Or you didn't understand anything? Huh?
Understood, Guruji. Understood. You taught so clearly.
So, when
Nothing
We
like
have to
that, sir.
search for questions.
when all of are silent, only two things I can make. One, you understood everything, and you didn't understand anything. That is the meaning of silence, right?
Sir, you made
Hmm?
us write straight away the rules, na, sir. State
Uh,
formula, state rules, and like
yeah.
it's quite.
Okay, so if you have understood, that is not an issue for me. Okay, so okay, fine. Then I will take your feedbacks
So good
very
that
less.
good that you, sir, without a big gap, you are connecting the medicine part also, sir. So that is a good thing actually.
Correct. Why? Because see, like I told, uh, if somebody is missing in that part, they at least should know something, right? What to use, how to use, something they should know. And right, people who are coming also, no problem, because there we will not discuss what we are discussing here. There will be completely will be focused on the remedial part. However, that will be more interesting. Means that will be not brainstorming like this. It will be like how most of you like give the points, we'll write down, and somebody comes and say the answer. Right. So
This we were enjoying, sir. This we were enjoying it. You know, a lot of people.
okay, fine. Some new students are also there. Let me take your feedbacks according, because this is the, though previously you all know, like students who are come to with trip to us and all, no, for them and all I have taken individual medical astrology those days, 2017, 2016 and all. But for a big group like this is 60 plus group, this is what first time you have done. Anyhow, so weekend cannot take. I mean, not everybody is present to take the feedback, but whoever is present, let me take your valuable comments. So accordingly, we can see what can be done and how you enjoyed, how was your journey, everything. Alphabetically, I'll take. So I think alphabetically, J sir will come first. I don't know whether J sir is not there or there, but anyhow, let me ask. J
Yes,
sir, are you
sir.
there? Ah,
Of course, sir. No, no. So
uh,
when you asked earlier that whether we understood that, sir. So
mm,
definitely, sir. It's just a matter of application. So now
mm,
when we apply, it will be more clearer, these rules that we've
mm,
learned. So I have
mm,
three things
mm,
to say, sir.
mm,
Firstly, sir, that I admire the commitment and the dedication with which you teach us and deliver what you promised to us. And in fact, more than that, despite the size of the class or who's there, or when we started in the class today, it was like 6, 7. Of course, then later on joined, but I could see that the commitment and the energy that with which you presented to us was undeterred. It was the same in a full class, and even though it is 5, so it is what you are living what you told us yesterday, that even if one student is there, you will teach with the same amount of energy and rigor. So I admire that effort, sir. So that was the first thing I wanted to say, sir. The second
mm.
thing is specifically about the course, sir. Now, this course, sir, is like, I would see it like a extension of the predictive astrology. So predictive astrology laid the foundation, the groundwork of everything, like the yogas and all the rules.
Correct.
This is a how to use that predictive astrology. So this is a demonstration of the use of predictive astrology, that this is in medical field, this is how whatever we've learned in the predictive astrology, we've used the same rules. But how to apply those rules is what medical astrology is about to me, which is what I've learned from this. And again, it's a fantastic thing that this is a demonstration of how we can use predictive astrology. So deep thanks to you, sir, that at least you've demonstrated that to us, sir. And thirdly, sir, very important also that yesterday or day before yesterday, you mentioned something very interesting, sir. You said that, somebody asked and you said, no, we can't bring in Nadi over here because when we are talking Parasari, we need to talk Parasari. Sir, it is a reflection of the rigor that you bring to your analysis and your study. Because, for example, I may speak X language, but because my knowledge of X language is not perfect, I bring in Y language words and I try to fill those lack of language with some other language. So that's a reflection of that my knowledge is not complete in one language. That's why. But what you've shown us, sir, that if you are really wanting to be a sound astrologer, then you must have a thorough understanding of one field so that you don't bring in another field.
Jay sir,
Even
voice
the
not.
oh, even the exam. Sorry, sir. Even the example, that Panchangam example we took the case study. You only looked at Panchangam, sir. We didn't look at any other thing. So you
Correct.
see, when you are talking about one language, you are only talking about one language only. That shows the depth and the rigor in that field that you have, the perfection in that field. And to me, what's clear is that being your student and being with you in this journey, knowledge of Panchanga, knowledge of Parasari, and knowledge of Nadi, if these three are combined, and to top it all, knowledge of Prasna, which you said 2 3 days ago, one Prasna you must have a sound grip. So these, when
100%.
you when I put together, just gives me a very good. It gives me a lot of confidence that we have somebody to guide us and who's perfect in each and every one of that, sir. I'm seeing more also, of course, may be there, but at least to us, what have you taught us, sir? It's complete depth you've got. You've gone to the deep end of the ocean to touch that and to know what's going on in each one of this. So very blessed, sir, to be in this group and to be taught by you, sir. So sorry I've taken longer than usual for the feedback. This is what I wanted to
No
say, sir.
problem, sir. See, it's not about the what is that? How many people are giving the feedback is concerned to me. What concerns to me is even if 2 to 3 people are giving, that 2 to 3 people sum it up what I have done in this time duration. Understand? That is what is required. It's not class, sir. Class was good, sir. Thank you. That is okay. That is like a formality. Understand? Okay, this guy has taken something. But some people will say what they came and what they expected and what they got and how they are applying. Now it's almost 12:30 or 12:45 in Singapore. Still you are waiting. That means what? These are the people who will definitely go up tomorrow that I will be witnessing it, and they will also get much better students, clients, everything. Because the person who stays back and expresses, I'm not saying others are bad or nothing like that. This is a special quality. Understand? Because we used to do that on the 10th or 11th day of class in our Gurukula Mandal. Everybody will go off. "Ayyo, appa, today morning we have to go to the bus." But we are the guys who used to take the last bus. We used to sit with the Guru used to feel good. Then we used to share what has happened, everything. And after that, the Guru will give another points. Understand? That means here, when your focus is that much high, even that last word of the class also, you are not willing to leave. That means what? That is how this subject should be there. Right. So that is the reason I never interrupt when you are some. There are, I know some people's feedback. I take it core because their feedback summarizes my course and it shows what I have done and where we are proceeding. Thank you so much for pointing out everything. Yes,
No, sir.
predictive
You are absolutely true, sir. I tell myself one thing. If sir can give new ideas to us and new charts to us and new case studies, I tell myself, can't I give a new feedback to sir? Why should I repeat the same thing? It's for me,
so
sir. I'm
that
not.
is so
I don't mean. I mean,
so
don't
kind of you. I
disrespect
know.
to anybody, sir. But can I come up with a creative feedback? Just a little bit. So today, sir, I went on a walk. And I'm just sorry,
Uh,
sir, I'm just extending this. And I told myself that
no
no,
problem.
please, what is it that you've really learned? How have you gained this course? You must put a thought to it so that when you go tonight to speak, then at least you have some words to share which are not the same that I've repeated somewhere else. Of course, it can be, but something different about the courses and relevant to this course. I may like you and I may like the way you look. That is a different thing. If I say that, then it doesn't apply to the course. But I
Correct.
tell myself I must say relevant to this course per se, then maybe I've done justice to being part of that 10-day program or 11-day program with you, and then I've done justice to it. Otherwise, sir, I tell myself, then you've not done justice by being here. So yes, sir. So thank you very much, sir, for those kind words, sir.
Thank you, yes, sir. Thank you so much. Like again, you told, yes, like yes, I told predictive astrology is very, very important. Understand to understand anything. That is the reason. Anybody who comes to me, I'll say it's not okay. They are coming. I'm getting this 20,000 rupees money for this course. Let me add. If 5 people I am saying no means 1 lakh I will lose. No, not really. That is a wrong guidance. God will give 2 lakhs instead of that 1 lakh. But guidance should be correct. After that they join or they don't join, that is up to them. But we have to guide them. Like I keep saying, if you don't know nakshatra, that predictive astrology course itself is like somewhat incomplete. Why? Because, like I told, first is bhava, after that is nakshatra, then it is degree. Without nakshatra, you cannot do remedy. Without nakshatra, you cannot do dasha bhukti. Right? I keep saying, people who already studied, but what they take, what they don't take is this personal choice. Understand? So thanks for reminding Jay sir, like not only for students and for you also, you have reinforced that the system. We should not divert at any cost. Thank you. Yes, Prasad sir.
Thank you very, very much, first of all. Second thing is, sir, it's not feedback actually. I'd like to convey my vote to your gurus.
Thank you so much.
And they have given you whatever they have given you. You are completing it for us. I'm actually, I would be like, I'm at a loss of words for this actually. With great humility, I bow to your gurus and then you. One
Thank
very
you so much, sir.
very significant thing you brought out in this entire course: importance of bhava, graha karakattvas. Now, once we are clear about what each bhava and each graha is going to give, I think your structure that you have given us is going to help us great. Thank you very, very much, sir. Humbled and with great humility, I thank you.
Thank you so much, Prasad sir. Like I told, like you are one senior person, you have been guiding us. So of course, that guidance will continue with the blessings of gurus, Uchista Ganapati and Siddhas. And like you told, whatever I am today, it's only that, what is that alms my gurus have given me. Like we say, Guru Pota Pichi. That is what I can say if I want to put it in a blunt language. Thank you so much. Yes, Rahul Alasi, sir.
Yes, sir.
Ah,
So, so basically, this journey started with consultation with you, and
correct, correct.
yes. So I don't know. I mean, many of might have gone through that route. But when you said, "Ki boss, you learn 3 courses, you and then take control of your life," I was little skeptical initially. But the way you have taught, sir, the content of the course, the structure basically, and your guidance and the rules, they are like, I mean, automatically now I am fond of everything, this astrology and everything. And definitely I will do your other courses, recommended courses also, sir. And
Sure.
thank you very much for your guidance, I mean, that personal level, as well as a teacher, as a guru also, because I keep on sending you queries and you keep on replying. Because I'm very new to astrology, like I was just knowing the name of planets. Even Nakshatra was also new to me. So, for a novice like me, very fresh person, even if I can understand your teachings, so definitely they are like great content. That is what I can say, sir. And thank you to your
Good,
gurus
good.
and thank you to you
So
also.
thank you. Thank you so much, Rahul sir. Yes, this is the first course you came in as a client and you had some astrological knowledge. I thought, okay, fine. For your all your queries, this question can be, this syllabus can be the answer. Hopefully,
Yes,
we have made some changes to that. And yes, more of remedial also is coming in the upcoming. So definitely
absolutely.
you will enjoy the time here. Thank you so much for your time. And More importantly, though you are not a regular student, you attended all the class regularly. So big thumbs up from my end for that.
Yeah, thank you, sir. Thank you. Now, I will not miss anything, sir. So whatever is recommended by you, I will follow it, sir.
Definitely, you message me after class, I'll get in touch with you. What is required for you to read a chart? Okay.
Yes, yes.
Fine.
Okay, sir. Thank you.
Thank you. Yes, SB madam.
Hello, Guruji.
Namaste.
I think yesterday I said, the other day that you have made spiritual doctors for all of us. I think that I've read so many. I second what Jay sir and Prasad ji says. I've heard them even in different Bhava classes and all, and I really think that they say everything that I want to say. That you are giving so many different dimensions to connect for us, and now it is up to us to apply it. It is not. With practice only, we can hone our skills. And I think the one thing that I took back from this is, knowledge can sometimes make us, quite powerful in our own mind. But what you have taught us is that the knowledge should make you humble, and then God will guide you, and your gurus will guide us, and you will as well. That's what I have learned, from listening to so many of your lectures. Thank you very much. Yeah.
Thank you.
Without humbleness, this, especially because we are treating someone and helping someone to get over an illness or a disease or whatever. Without being humble, you cannot treat someone.
Definitely, that is very true. How much ever knowledge you gain or how much ever expertise you get over anything, even for that matter, a doctor or an astrologist, if you don't have humbleness, there only your knowledge falls. That knowledge is a blind knowledge, right? That is not useful for anyone. Thank you.
Yes, I think that you have given us like a garland, where a lot of different flowers, and you have taught us to connect different, aspects of astrology. So, yeah, that is really very, very deep. Thank you.
Thank you. Thank you so much. Because she told Garland, I remember one this medical astrology consultation. Anyways, I'll tell in the end. So the people who can give feedback can leave. Okay. So yes, Shastri Prakash ji.
Yes, sir. Namaste.
Namaste, sir. Namaste.
Sir, very knowledgeable to me, and too many new concepts I comes to know. And what a great content you teach us, sir. By very different dimension, you give as much as possible. Now, what to say that I know, but in one word, I said very excellent, very excellent, very excellent, sir. Excellent.
Thank you. Thank you so much. Even the busy schedule you are making to attend the class. Thank you so much, sir. Thank you.
Thank you. Thank you.
Yes, Shonak, sir.
Yes, sir. Good evening.
Good evening, sir.
Well, sir, great class as usual, and based upon the structure and the roughly 27 diseases which you have taught us, we have already learned, or we have done astrological blood test, X-ray, ultrasound, and MRI. We have done astrologically this, and now we are looking for remedy in the batch flower course, and that means MBBS part 1 we have done, and MBBS part 2 we will do. Precisely we can say it in 11 days we have seen medical astrology made easy, right? That's the title of the course, Medical Astrology Made Easy.
Made easy. Awesome.
That way we are blessed, and we are happy that such a difficult course, which is medical astrology, that you get so scared also sometimes. So now you have taught us part 1. So we are looking forward for part 2 very eagerly and very anxiously.
Definitely. We'll do that.
Thank you so much.
Thank you so much, sir. Thank you. Yes, Shil, sir.
Namaste, sir. So, fantastic learning, sir. Sorry, I am just breathing because I was going through the stairs. But, sir, I wanted to say, I would say every course is a flagship course. I really wanted to say this. Number one. Number two, sir, what a structure, what a way of designing. I mean, the way you have delivered like the formulas, the sutra straight away to the point. Because I have gone through few of the, few of the charts and applied, and I got straight away results. Straight away. I mean, no confusion, nothing.
Super.
Just apply the sutra and the transit. If you know the dasha pattern very well, then you can straight away pinpoint it. So that
Correct.
also I've checked. And sir, the best thing what I've seen is, and sir, I also want to take this opportunity. The way Prasad sir has mentioned, I also want to, sir, I mean, from the heart, I bow down to the gurus and teachers of yours and to you, sir. So thank you so much for sharing all this because, sir, I'll tell you something very honestly, sir. There are, I mean, I will not compare this, but you really give it, sir, from the heart, and the passion, that energy can be easily seen, sir. You are seriously doing a justice. And also, sir, one more thing. It's like I don't know, but I feel like it's like you're setting an benchmark to the teacher. Like this is the way it has to be delivered. This is the way it has to be given completely. And what to say, sir? I'm feeling falling short of words. This is the course
Thank
I've been
you. Thank
waiting
you.
from so long. In fact, sir,
Correct,
from
correct.
so long.
Like even 1 year
And
back also you asked when you will start
yeah,
medical. I told after Bhavas
yeah.
we will do medical.
Right, right.
Yeah.
And sir, the way you delivered, sir, the best point I was thinking like how sir is going to teach and how it is going to be the format and all that. So the surprisingly the best part, the way you deliver, it's like not complicated, like straight away, okay, fine. This is a sutra, this is the karaka, this is the bhava it is going to affect. You have to identify now. So I mean,
Correct.
you have given us the freedom to explore also. Like, now we have got that roadmap. So I really, sir, I mean, and sir, daily whenever I listen to your like the recordings, the courses and all that. So specifically this Prashna, sir, I'm like daily I'm enjoying. It is giving so beautiful results, sir. People are like getting astonished, for how from where you are looking at this. Prashna is like out of the box or something. Once you get the grip, it you can go to the next level. So I really, sir, thank you
Correct.
so much from the bottom of my heart. Thank you so much.
Thank you, Shil sir. Welcome. Like Jay sir said, or you said, or most of our students say, Prashna is like very important. I keep saying every time. Understand? That is the reason I told 6 levels of Prashna techniques, though each of them are not connected, they are independent, unlike the predictive astrology course, Bhava course, or something like that. These are independent, but the reason is those are the 6 dimensions, like Jamakol, Choli, because like I told, Choli is a mother. If any problem is not discovered to natal chart or any other person, Choli can suck it and show you and what is the way to come out of it. That is ultimate. Tamula Prashnam. Okay, and 28 different kinds of Prashnam also we did, right? Sir, I am not very good at calculation.
Yes,
Is there
yes,
anything,
yes, sir, you
anything
did,
within,
sir.
right, within 5-6 minutes can I do and still give a valid and excellent answer? Yes, we have that. Not one Prashna. We taught
Yes, sir.
almost 28 we told, I think we ended up in teaching almost 31, 32 Prashnas we ended up.
32, sir, 32, 32.
32
Sir,
right.
that is what I left off, sir. I forgot to mention. I'm so sorry. Every course, sir, beat any course, sir, you always give what is being written as per the syllabus. You always give more than expectations. And, sir, you know what? Prashna like that Pada thing and numerology, no, sir. I'm mixing them both and experimenting it. It is just giving like, tantric numerology. You can also identify the phone number like. I mean, beautiful, sir. The way you teach is like, sir. I mean, I'm not exaggerating, but sir, hats off to your teaching, sir. Excellent. I mean, we are damn lucky, sir. We have done some punya karmas. That is why we are connected with you, for
It is
sure.
always mutual from the what we did for our gurus, and they said we said that to them, and they said, "Don't worry, you will also will have that." And I am saying, "Don't worry, you also will have that."
Thank you,
So
sir. Thank you,
that's the
sir.
cycle repeats. Okay, good, good. Yes, Uma madam.
Yes, sir. Namaste, sir. First of all,
Namaste.
Purpadam Potri, Purpadam Potri, Purpadam Potri, sir, to all the gurus and to all my gurus as well, sir. So this is like long awaiting subject, sir. Remember, sir, in Jamakol, that was the first course that I had enrolled with
You
you.
enrolled correct
The
2023.
first thing that I asked was, how about in medical astrology, sir? From then, I have been waiting. And I still remember what my first guru said, sir. Because they say what my guru said was, first thing, Uma, you have to learn all the Bhava characteristics, Rashi and Graha. You should be well versed in this. Only then you will be able to understand the ABCD of medical astrology and the Prashna
Correct.
as well, sir. And I'm in that path, sir. Till date, I have never forced you for any course. I knew at the right time, with Sai's blessings, we'll be able to receive all that is to be received. Only a parent and a guru knows when what to be given to a particular child. This I strongly believe in, sir.
Very true. Very true.
No doubts about it, sir. And any course that you announce, I don't do any research, sir. Okay, sir. I sit like an open book, receive it. Then I practice it, sir.
That is the reason I said we have 25-30 people who don't even see the content. They know like what he is teaching. Like some may think like financially rewarding, or some may teach knowledge-wise rewarding. Either way, it is not bad taught. Why no? You are spending something, and yes, if I spend 10,000 also, I'll earn more than a lakh when I teach. And somewhere you think if I spend this 10,000 also, I am getting that knowledge, which is that 10,000 is hardly anything for that, right? These are the people that 25-30 people who are connected with us. That is what makes me to give you more and more. Like I say, from here when you go and teach your students, you will be still my student. But when you teach your student, you will not be learning for anyone. Rather, you will be writing a book or you will be developing on your own. Now I given easily you can write 2 books on this, right or not? So
Definitely, sir.
that is what has moved me, and that is what we'll keep doing it again and again with all your students.
So I totally agree what Jay sir and Prasadana said. Yeah, it's like a mala, sir. Like each and every beads that we are just putting in together, and we are forming a beautiful mala, sir. It's like the spell. It's like the dewdrops that we are receiving it from the cosmos. And especially, sir, when I was going through one of the prashna, it was all about a simple UTI, sir. They just ignored it. So I applied whatever the rules that you gave. It just flew automatically. I never even looked into the book, sir. It was like along with the rules, along with the structure that you had given, I went on, sir. And it was so surprising. It was a chronic hormonal disorder, sir, that was.
Disorder.
So I said, please take care. Otherwise, it's going to lead into multiple dysfunction of the various organs. Please, you have to have a emergency look into that. So I was literally thanking sir. And then I also included the other therapies, what I had learned. In fact,
super.
how to remember them, sir. Now, for example, sir, I'm taking a few more minutes of yours. Like in and out concept, I got it.
They will not.
Sir. I got the concept of yin and yang here, sir. Because it was easy for me to differentiate, because when you were saying lungs, Gemini and Cancer, and Gemini takes care of the structure and the function. So there yin and yang also works intermittently, yin works continuously. And similarly, heart, Cancer and Leo. Now Cancer continuously, it takes care of the internal functions. The external part of the heart is the Leo. So like this, I started linking yin and yang, sir. And the energy system I included into this. So this also reminded me all my old gurus, sir, from the medical background. You just revived all the research that I had buried long time due to various reasons. Okay, sir. You have just revived all those thoughts now. It's like one of my professor coming back to me in the form of you saying that, Uma, it's time you wake up. Continue the process that you had left unfinished.
Super.
So this is what I feel. It's you can feel through the vibes. I can feel the presence of all. Thank you.
Excellent.
Thank you wholeheartedly, sir. Thanks a lot.
Thank you so much.
For Padam Potri.
So I have to be thankful for most of the students here. Why? Because though everything is done, like these are even like 2-3 are missing because they are on some trip or something. What is that? Spiritual thing. So because they are on this thing. Otherwise, yes, like we have that 3-4 students along with this who we have here, who will not mind till that last moment the student finishes. Also, they will not go. Like that reminds me of my learning days with my gurus, how we used to do. Right. That is the reason I said there are certain people here. Definitely, they will change that way how the astrology looks, because you all are multi this thing. Like some people are specialists in Hindi, some can do it in Kannada, right? So that way, that style is also going to go further. That is what gives me more happiness than anything else. So let me take Vinay sir's, then I give a last 1 or 2 minutes, then I will wind up. Yes, Vinay sir.
Uh, Thank you, Guruji. Thank you so much. This course is so very beautiful. It actually changed the way I look into health also. And now it's not only like, we assess the people just by the body or, tests and we see. We can know by this and help them to tell them that this is going to come in your future. So we have to take care of that. That is one part. And I think we are more luckier than you actually, because you had to
Very
go
true.
you
Very
had to
true.
go
Certainly.
to
Cheers for
Yes,
that.
it's very true, sir. Very true.
you had to go to so many gurus and learn the knowledge it the very hard way. Now, reaching them only is hard, and learning it was also very hard. And we are so lucky wherever we are sitting, and you are converting what you had thought so hard in a nicer way and more easier way, so that we can understand. And you're giving it to us. I don't know how to thank you for that, Guruji. I really don't know. You transformed that what they thought so hardly, so that we can understand in this generation sort of time. That is wonderful in your teaching. I love that, and especially your teaching and your the subject wise you made the curriculum is awesome. First, you took the karakas and this, and then you told by that only we can derive everything, and you made us do it also. uh, that made us that confidence that yes, I can do this now. Yes, I can get this now. I have a hand of this now. And thank you for not making us fear about this topic.
Good.
Yeah.
That is what I wanted.
Everybody like, oh, you are doing this, it's very hard, and this subject is like that. Then they would tell us something else and make us fear
Yes.
about it. You never made us fear about any of the topics or any subject, and made us told us be confident and you'll be clear with everything. Yes, that was also there. As you told in the first few classes, we felt that all seeing all the combinations in my chart. That was there. Later on, all the cancellations also came into picture,
Correct.
and then we came to know what can be done. And next, in few weeks, we'll come to know how to cure that also. Thanks for helping us,
Correct.
and thanks for helping us to help others. Thank you so much for that,
Definitely.
Guruji.
So
Thank you
thank
so
you
much.
so much. Yes.
We'll
That's your
always thankful for that.